all the UAE system, I mean Dubai systems, is risk-based, and all it's going very well together. But we are still actually facing challenges. We are still facing issues that we have to work on it. Let's see some statistics. More than 10,000 food establishments in different food sectors are working in Dubai. And this number, I think it will double. You can see the Expo logo in my presentation. It will be doubled when they announce the Expo in a few days. Not doubled once, maybe twice or three times, we are not sure. 8.6 million of food tons imported in Dubai in 2013 only. 180 countries are exporting to Dubai. More than 3 food establishments applied PIC. So it's Person in Charge program, which is almost 60 targeted groups. And this is actually lots of efforts from Food Control Department to work on. It's not easy figures to reach. And we are just 200 people, or 200 to 300 people working in this department. So how we can manage risk, how we can manage all these changes, what we have to do. Let's go to the next slide. What we are expecting in food safety. Okay, almost 98% of food premises satisfied based on DM requirements. But when I'm talking about 98, I'm talking about premises which are getting C score, which are, I think, the majorities. So is it enough for our visions? No. We are looking for more than that. We are looking for more A scores. Because the food is, in case if it's monitored very well in the ports, it can be spoiled in your premises. It can be wrong practices that one of the employees doing in your premises can cause a leading problem in our industry. Achievements in food safety, what we achieved in the last few years, we worked comprehensively in issuing Dubai Food Code. I will go in details what are the programs, but I will list it for you now. Implementing PIC programs since 2012, building food outbreak surveillance system, implementing comprehensive development tools for the food inspections and establishments like Food Safety Clinic and Thumbs Up. So what is the Food Code? The Food Code is a comprehensive guideline that collects all the best practices and leading practices in the world. That includes also international standards. That's being reviewed more than 2 or 3 times by the industries themselves, and the feedback being collected to finalize it as a food code. So it's the goal of the food code is achieve high standards of food safety through adoptions of good practices and increasing the public health practices, increases the awareness among the food handlers about what are the best practices and good practices in the food safety. The scopes include everything: hospitals, schools, bakeries, food catering, grocery stores, supermarkets, department stores, butcheries. We worked 3 years to include all these areas, but the manufacturers has got its own specifications, and the food code serve manufacturers, but not in that much details. So the manufacturers teams working comprehensively to finish around 18 guidelines, and to publish it to 18, as this is the minimum number, and to publish it to the industries very soon. Content includes everything. Everything that included in the food processing, licensing, approvals, constructions, designs, facilities, control of hazards in foods, control of cleaning and maintaining, personal hygiene, training of food handlers, provision applicable of the sale, import and export requirements. And the challenges in this food code, we just announced it like, I think 6 months before. We need to work with our inspectors before we go to the industry. The enforcement comes from the inspectors, and it's not actually enforcement, it's encouragement. So our inspectors must be well known about what's written in the food codes, to know how to decide about the violations or bad practices, or to know how to train the industries in order to achieve the requirements. So one of the most important challenges are our inspectors. So what we are doing now, we are training the inspectors, and we will go to the field and evaluate their practices or their inspection or audit programs in the field. Are they using the food code or not? Are they understanding what's written in the food code or not? Because they used to use, you know, their checklist, which has got a list of findings. So we don't want just risk-based inspection. We need more evaluation. We need more risk approach-based decision-making. So the second challenge is building positive culture in the food establishments by developing more communication channels between DM and the food establishments. We need to talk with them more. We need to discuss with them how they can apply the food code. We have actually lots of channels, but some food premises, maybe they don't find the way to talk with us. They don't find maybe even the right telephone numbers or whatever. We have to go and find these establishments, or at least to provide with them good telephone lines, good internet sites that they can deal with us and discuss their challenges or their problems. So foodborne disease surveillance system, it's one of our main programs that we worked on it. Actually, it's in UAE. I hear it since long times, but we never knew about it. We never communicated with the health ministries before and discussed the problems regarding the food surveillance. We never discussed food outbreaks, so it wasn't existing in the reality. Before of Dubai Municipality announced it and said we need it, we need to work on it. So what we did in food surveillance, we worked with the CDC and WHO. We put the guidelines of food surveillance. We put the instructions. We trained the hospitals. We worked on the notification systems. And we actually we are now covering almost 60% of population, as I mentioned in my previous slides. And we start getting data. But there are more data about the pathogens. But we are facing some problems that maybe Mr. Moheza mentioned it. What are these problems or challenges? I call it challenges. Almost 60% of Dubai population are covered, not all populations. And this 60%, or these hospitals who are representing the 60%, are they notifying in the right way? Are their notification is active and positive notification? So we have to do more active surveillance and go back to these hospitals and work with them. We have to work on laboratories reporting system for species serotyping. They say salmonella, they say hepatitis, but they don't give us species. And some food laboratories also do the same. So how we can link the food to the cases? It's very difficult for us. Work on building capacities of laboratories, specific capacities that works for the outbreaks. Like PulseNet, we need to be in the world network, in the world data bank. We need to see what the world are facing and what are coming from the world to the Dubai and what's going from Dubai to the world. This network techniques are missing in our laboratories. So the next program is PIC program. Person in charge program works to develop person in charge who has an active role in the establishment. What he will do, he will get training to lead the change on behaviors based on knowledge and attitudes and practices. It's not just a training program. We need to see some skills in the premises. We need to see the cultural change in the premises, and we need to see A scores. So the main principles and responsibilities of PIC are the catches. Let's go back. Cross-contaminations management. Active managerial control, so we need lots of managerial skills in this program. We don't need just normal food handlers, so usually we pick up one who has a good personal character, who can communicate with the other food handlers, and who can implement the change. Time and temperature control, what is it? Lots of industries, 5-star hotels, big restaurants talking about it, but you will not listen some food handlers in the small restaurants talking about time and temperature control. So it must be ensured in our system. Cleaning is not just cleaning. There are lots of disinfectants that must be approved by DM. They use some specific tools. They have to know how to use the pH and so on. Hygiene, emergency, understanding the hazards, and the source. You know, we are importing foods from all over around the world, and traceability is very important. And what we are facing in our food poisoning system, that many of these cases we cannot trace back because they keep ignoring collecting the receipts, they keep ignoring collecting the releasing reports. But the good thing that we have food import and re-export systems, so most of the cases can be covered by these systems. Challenges in the system. PIC evaluation studies shows that 30% of the premises actually made immediate change in their premises. But the rest are showing slow developments or no developments at all after 3 months of evaluation. So why is that? Many PICs have no management or leadership skills. Yeah, we picked up them, we trained them, but when they went back to their premises, they don't know what to do. They know they have the knowledge, but they don't know how to deal with this knowledge. They don't know how to make the decisions. And some PICs are not empowered to lead the change. Their top managements are not listening to them. Their top managements are not believing in food safety. The change is expensive and time-consuming in many of food premises. We are talking about the food chains. Any change could lead to lots of money, losing lots of money. It's short-term of loss, but long-term of profit. So they have to understand that. So what are our steps for that? Some steps are already in progress. We're re-evaluating the personal skills of weak PICs, establish a dialogue with non-responding top management. We have to find them, which is a bit hard for us. So now we go back to our inspectors, give them extra work. We keep giving them extra work. But I hope by the end we'll end up with a very strong system that doesn't need lots of follow-up from inspectors. Enhance the application of food code requirements. Food code is there for them. Actually, it will help the PIC. It will help the establishments. What clinic, maybe I didn't have a chance to talk about the clinic. Clinic, actually, it's our clinic for food establishments, the poor food establishments or which don't know how to make the change or how to lead to it. So we bring these people and meet with them and work with them for 2 or 3 weeks programs, to highlight their problems, teach them, coach them, and follow up with them. Put even the plans of the change. We work together to put it together, and after that we re-evaluate them, and somehow you can find them changing from C to A, even though. Thank you. I just picked up, the most leading programs that are going just right now, but we have, I don't know, hundreds of programs are going on. Thanks very much.